Our children. They are our pride, our joy, our hope, our future. In a world filled with uncertainty and risk, we do everything we can to protect them. But sometimes, all the love in the world is not enough.
When Ellie first started coughing, I knew that it wasn't just a normal cough.
Diseases that many thought were part of our medical past.
We couldn't figure out, how that disease is still around.
Are still an ever-present threat.
When she was first confirmed to have pertussis, we were kind of in disbelief.
They are diseases that don't reveal their true nature until it's too late.
One day she had a cold. We thought it was just a virus.
Diseases that can cause permanent damage in just hours.
But if you go straight into septic shock from the disease, you could literally have hours before you die.
Diseases that can damage the brain.
She's done everything opposite of what they wanted her to do.
Diseases that can maim the body.
I lost these 2 fingertips and both of my legs below the knee.
Diseases that can take away lives.
After 4 days of being in the hospital and a few days of being on the respirator, her body just couldn't take it anymore and just began shutting down.
Diseases that cause so much pain, so much heartbreak, are also diseases that can be prevented through immunization.
I'd like to believe that there will be a time when education is enough, that people will realize that vaccines are something that we have to do as parents, because as parents our number one charge is to put children in the safest position possible, and vaccines provide that safety.
I've seen children die. I've seen children die from vaccine-preventable diseases. And that's enough, right? Knowing that, having been there at the bedside, seeing a child and saying, if we had vaccinated this child, they'd be running around and playing right now, instead of lying in this hospital bed about to die. That's enough for me. All 4 of my kids are vaccinated, and every person I know, I plead with them to make sure their kids get vaccinated too.
Do you know what vaccinations are for?
Yeah. I think it's to help your immune system. I'm guessing.
Yeah, that's absolutely right.
And to help you from getting the big diseases, can be life-threatening, and the horrible diseases.
These Florida middle school students may not know all the science behind vaccines, but they do understand the basics of immunization.
You build an immune up.
Yeah.
Because everybody gets a small injection of the disease, and your body builds an immune.
The whole idea of vaccines is if you give some version of a disease to someone, a very attenuated or changed version of it, that body's natural immune system will recognize it, and so the next time that the disease comes along, your body's able to fight it off. So it's a way of boosting your natural immunity. And the first ideas of inoculation sort of came hundreds of years ago, probably in the Arab world, out of this idea of maybe that's a way to prevent death and disability. And over the years, there were changes, and one of the most important was Edward Jenner, who recognized that a different version of smallpox, cowpox, which is a virus that's related to smallpox, if you got infected with cowpox, what would happen is you would get very mild disease, nothing bad at all, because it was actually much worse for cows. But they would protect you against smallpox. And here the idea of immunization, that if we gave something to your body that would help you mount a defense, then the next time you saw the real virus, you'd be able to fight it off. So it's a way of taking advantage of your body's natural defenses.
After a period of slow acceptance, Edward Jenner's vaccine approach became widely adopted in his native England. Immunization using Jenner's method was key to decreasing smallpox deaths.
It's hard to remember because almost all of us don't have a lifetime experience with smallpox, but it used to be among the most infectious diseases. Over the years, as I said, it caused deaths of probably 1 in 10, maybe even as many as 1 in 5. 20% of a population probably died because of smallpox. Over the years, because of things like improved water, improved food supplies, sort of the strength of people getting better, the mortality went down. But the biggest change probably was widespread vaccination. And the last case was in the late 1970s. And since then, there's been no more smallpox in the world. This is an extraordinary example of how powerful vaccines can be for improving public health.
Despite the development of the smallpox vaccine, as well as vaccines against rabies, typhoid, cholera, and plague during the early part of the 20th century, diseases continued to take a horrible toll on the U.S. population.
It was a terrible, terrible time. We were scared, very scared, rightly scared of infectious diseases which killed us.
Have you guys ever seen anybody that had polio or smallpox?
I've heard of polio.
I've heard of people in my family having polio.
What you have to remember is that up through the 1930s and 40s, polio was an extraordinarily scary disease. You never knew when it was coming to town. Every summer, people would worry, is this going to be the year that polio comes to our village, our town, our city? And if it did, you didn't know what was going to happen because every once in a while, a regular cold, a little bit of a flu, would turn into paralysis, would turn into the ability not to breathe, could even lead to death.
The last thing in the world my parents thought was that Frankie and I would contract polio. We were doing everything the public health community told us to do, but the one thing we didn't have was a vaccine.
Jan Nichols and her twin brother Frankie were happy, healthy 6-year-olds in DeWitt, a suburb of Syracuse, New York, when their lives took a tragic turn in October of 1953.
Frankie suddenly developed a terrible time breathing, so he was rushed to City Hospital, which was a hospital for communicable diseases in Syracuse at the time. He was immediately placed in an iron lung because he couldn't breathe, and he was given a spinal tap to determine whether he had polio or meningitis. By the next morning, they knew that Frankie had polio. He died with my dad cradling his only son the best he could when Frankie's little head and neck were the only things that were outside of that iron lung.
61 hours after being hospitalized, Frankie was gone. 3 days later, just after her twin brother was laid to rest, Jan began feeling sick. Doctors diagnosed her with polio.
The first 3 or 4 days, I had a very high temperature and I could have died at that point and never would have known anything. When I woke up, I couldn't move.
As Jan dealt with paralysis, polio continued to take a terrible toll on her community.
Our epidemic was very severe. So out of the kids in DeWitt that had it with us, there were 12 children and one young mom. Frankie died and 2 of our friends died.
But soon, DeWitt and other communities across America were fighting back. A young researcher at the University of Pittsburgh, Dr. Jonas Salk, had developed an injectable vaccine against polio. It was now time to test the vaccine. Jan and nearly 2 million other children took part in the Salk vaccine trials, the largest statistical field study ever conducted in the United States.
The parents in our community would have done anything to stop polio from affecting their children, so they had no trouble signing their kids up for this vaccine trial. So what I remember the most about being in that trial was that the vaccine came too late for Frankie. And it made me very, very sad, but it also made me determined. We were told that we were doing an important job, and I was determined to be a part of that important job because I didn't want other kids going through what we had gone through.
In 1955, Salk's polio vaccine was declared safe, effective, and potent. By 1963, reported U.S. polio cases plummeted to just under 400. In 1979, the last U.S. case of polio caused by wild polio virus was reported.
By the late 1950s, polio had virtually disappeared from the United States. And it was this really powerful example in the American psyche of how government funding, private philanthropy, and medical science together could eliminate any problem. And in this case, it was polio.
The polio vaccine came too late for Jan Nichols' twin brother Frankie, but she says we cannot forget the deadly lessons of the past.
If you go through an old cemetery, look at the headstones of all these young little kids who died, probably most of them from vaccine-preventable diseases. They're serious diseases, and that's why the public health community is so adamant about the importance of vaccination.
Vaccines have been called a victim of their own success, and what that means essentially is that vaccines have reduced the occurrence or incidence of these diseases by anywhere in the range of 90 to 100% for the vaccines for which we the vaccines that we use. Because of that, providers, patients, their parents no longer see these diseases. So there's less motivation to use a product to prevent something if you don't see it. We have really great vaccination coverage, so that is a great thing because we're not seeing the diseases, but it also might cause providers to become somewhat complacent about these diseases.
My doctor did not tell us about the pneumococcal meningitis vaccine. They need to tell people just how important vaccines are.
Today, most parents of young children have not seen the consequences of vaccine-preventable diseases firsthand. Lori Hops and her daughter Brianna live with those consequences every day.
She's having seizures, by the way, right now, so you're fixing to see a bunch of these. These are the head drops I was telling you about.
In some ways, Brianna, or Weeble as she's known to family and friends, is just like any other kid.
Nice.
But Weeble faces challenges most other kids don't.
She's not social at all. She doesn't like, even in school, she pretty much stays to herself. She doesn't like big crowds. She doesn't like a lot of people. As you can see, she kind of blocks everybody out and just does her own thing. So she's not very, she doesn't interact very much with people.
Brianna was born a beautiful, healthy baby girl in Central Florida in 2002. But just before her first birthday, she became sick.
She had a fever, and she had a runny nose, and then she started the vomiting, and she just slept a lot. She was real tired. So it did just look like a cold, the flu or something. And then it wasn't till she wouldn't wake up, and she couldn't hold her head up, and she wouldn't sit up. That's when we knew something was wrong. But by then it was too late. They did 2 spinal taps, and then they had to do the 3rd one in Orlando. They took her up there, emergency, and they found out it was meningitis.
Weeble had contracted strep B pneumococcal meningitis, a disease that causes inflammation of the membranes that protect the spinal cord and brain. It's a disease that kills roughly 20% of its victims. Weeble had a stroke that left her brain damaged.
They said she wouldn't make it through the night. She wasn't going to make it through the night. And the guy said it like 7 times. We don't think she's going to make it through the night. Yeah, I don't think I really thought she would make it, so... Our great-grandma was planning her funeral, but I wasn't. I didn't really think they were serious.
Weeble fought back and survived, but her battle with pneumococcal meningitis has left her and her mom with a legacy of seizures, surgeries, and heartbreak.
She's now has the mind of a 2-3-year-old, and it's slowly, and she's been about a 2-year-old since that day, so in 8 years it hasn't really changed much. So she's forever, a baby, pretty much.
The disease that robbed Lori and Weeble of so much is a disease that could have been prevented with a dose of vaccine.
The pneumococcal conjugate vaccine was licensed in 2000. This is a vaccine that we give to young infants for the prevention of infection with the pneumococcal bacterium.
The pneumococcal vaccine is just one of the vaccines that have been developed in the past couple of decades that have helped keep infants and young children safe from disease.
What's extraordinary now is if I'm at home and I get a call from a family and it's midnight and the child has fever and parents are worried, my first question is, has your child been vaccinated? And if they've had their vaccines already, I can say, you know what, this is a virus. I'll see you in the morning. If it's not better, we can take care of it, but it's not a big deal. Just 15 years ago, I would have had to say, there's a chance this is meningitis. There's a chance that this is bacterial sepsis. You need to go to the emergency room now. 1 out of 3, 1 out of 4 children used to die before the age of 5. Nowadays, it's probably more like 1 in 1,000. And that change is partly due to vaccines, not entirely. But if you look at the value of medical science for improving health overall, vaccines are number 1 on the list.
Babies get 6 vaccines between birth and 6 months of age to protect them from several serious diseases. Infant vaccines may be given separately. Some can be given together in the same shot, and these combination vaccines are safe and effective.
If you combine vaccines, you can lessen the number of shots, which then presents, a lesser stress to the child. I can understand how it's hard to watch children get shots. I mean, I think anybody who's human, who watches their baby get as many as 26 inoculations in the first few years of life, or get 5 shots at one time, can feel that it's overwhelming, and that makes sense, but it isn't overwhelming. Is a child more stressed by getting 2 shots, or 3 shots, or 4 shots as compared to 1 shot? That actually study has been done by a group of researchers who measured stress by the secretion of cortisol in the bloodstream, which is a typical way physiologists measure stress. And what they found was that children were no more stressed getting 2 shots than 1 shot. The point being, 1 shot is maximally stressful, I think. And so you could argue by continue to bring children in at 2 months, 3 months, 4 months, 5 months, 6 months for just 2 shots at a time, you're increasing their level of stress. You're making them only more needle phobic.
To help parents and providers keep track of immunizations, the Centers for Disease Control and Prevention publishes an early childhood immunization schedule. The schedule is updated every year, and it specifies which vaccines are required and exactly when they should occur during a child's development from birth to age 6. You can find the immunization schedule online at www.cdc.gov/vaccines.
I think this schedule is very appropriate. And it's, of course, it's prepared by the Royal Smart people. It's not prepared by trench doctors like me. It's based on years of research and efforts to make sure that it's really the best thing to do for the children.
When a vaccine comes onto the schedule, the FDA requires that those who make the vaccine show that it doesn't interfere with the safety or the immunogenicity profile of existing vaccines, and vice versa, that existing vaccines don't affect the safety or immunogenicity profile of that vaccine. So it's a well-tested schedule.
Pediatrics prevention's the name of the game. We know that whether you're talking pool safety or booster seats or immunizations, it's far better to prevent a disease or a disaster than to try to repair it.
Lori Hops is trying to repair the damage that pneumococcal meningitis did to her daughter Brianna as an infant. She says healthcare providers need to stress the importance of early childhood vaccines.
This could happen to their kid too. You know, you don't want, you'd rather chance a fever or a headache over brain damage and forever lifelong disabilities. So I think vaccines are definitely, something people need to do for their kids. And not just for their kids, for everybody else's kids.
I remember my mom told me, oh, it's not going to hurt. It's going to feel like a mosquito bite. And when I was done, I'm like, I don't know any mosquitoes that bite like that. Because it hurt.
I'm always nervous. I don't know why before I take a shot, but I'm always like, I'm so stupid for getting nervous for a shot because shots don't bother me, but I still get nervous before.
As these Florida middle schoolers have learned, shots aren't just for babies and young children. There are vaccines specifically recommended for adolescents to help them avoid dangerous diseases. Yet adolescent immunization rates lag far behind childhood immunization rates.
Probably the biggest reason that vaccine rates are not complete in teenagers is that parents don't know that they need vaccines.
I think we tend to think of immunizations as a kid's thing to do, and so we're very good about immunizing kids, but we get less good about immunizing people as they get older. And so our immunization rates for adolescents aren't nearly as good as they should be for vaccines like Tdap, tetanus, diphtheria, acellular pertussis, or the HPV or human papillomavirus vaccine, or the meningococcal vaccine.
3 diseases in particular pose a risk to adolescents and young adults because of the close personal contact they share: human papillomavirus, or HPV, meningococcal disease, and pertussis, or whooping cough as it's commonly known. There are vaccines that can prevent all 3 of these diseases, but many people are not taking advantage of them. This is especially true when it comes to a vaccine that's been hailed as the most effective way to prevent several forms of cancer.
In terms of cancer, this is the best news we've had in a very, very long time. We need to capitalize on it.
Dr. Anna Giuliano is a researcher at the Moffitt Cancer Center in Tampa. Her research helped lead to the development of a vaccine that protects women and men against several strains of human papillomavirus, the most common sexually transmitted virus in the U.S.
It's a really common infection. Approximately 80% of women at some point in their life will have been infected with human papillomavirus.
HPV is not only common in women, it's common in men.
The infection in men is as common or maybe even more common than it is in women.
Most women and men are able to effectively clear HPV infection through their own immune response. But for others, HPV can create lifelong health issues.
The most common health problem for both men and women is genital warts.
But certain strains of HPV can also cause several potentially deadly cancers in men and women. Persistent HPV infections are now recognized as the cause of essentially all cervical cancers. The National Cancer Institute says about 11,000 American women are diagnosed with cervical cancer every year, and about 4,000 women die from the disease.
The cervical cancer developer would be the rare patient. However, everybody comes in contact with HPV, so why not get rid of this disease once and for all by vaccinating every kid in the United States? Because to say that I'm not going to come in contact, it's really silly. Everybody's going to come in contact with the disease at some point in their lives.
The HPV vaccine is available as a 3-dose series administered over 6 months for females ages 9 through 26. However, routine HPV vaccination is recommended for girls 11 to 12 years old. Males may also receive the vaccine from ages 9 through 26.
And this vaccine is highly effective. We're talking close to 100% effective in preventing the infections that the vaccine is directed against.
Despite the protection the HPV vaccine provides, coverage among adolescents remains low. According to the CDC's 2009 National Immunization Survey, only 39% of girls in Florida received at least 1 dose of the 3-dose HPV vaccine series. Nationally, that rate was only 44%.
It's incomprehensible to me that we have a way to eradicate this disease and we're not going to do it. The vaccine was released in the summer of 2006. 4 years later, if we look at all the potential recipients of this vaccine, in other words, all the kids from 11 to 26 that could be vaccinated, only 12% have been vaccinated. So this is a very terribly missed opportunity. There are literally millions of kids that got infected with HPV between 2006 and now that should not have been infected.
While HPV spreads by sexual contact, another potentially deadly disease often spreads when young adults are in close contact with one another in places like college dormitories. It's a disease that often masquerades as the common cold or the flu.
There are still some very well-trained doctors that totally miss it. So it's a hard disease. That's why it's better to prevent it than to treat it.
Meningococcal disease took Abby Wold's legs and nearly took her life in 2003 when she was just 22. After a night out with friends, Abby began feeling sick. At first, she thought she had a fever. Within hours, she was near death. She had contracted meningococcal meningitis.
From there, I don't really remember much. A lot of things happened between there and when I woke up. I had multiple organ failure, obviously. I ended up on a ventilator and in a coma. When I woke up from the coma, I couldn't move anything. I guess whenever you're that sick, after your body uses up everything else, it starts destroying your muscle mass too. Or something from the kidney failure. I don't know what it was. But anyway, so I had to relearn how to do everything. Like I couldn't brush my teeth. I couldn't lift my arm off the bed. I didn't have enough strength to push the call button on the nurse, the little remote thing for the nurse. I lost these 2 fingertips and both of my legs below the knee. And I had to have a fascial flap pulled down from the top of my arm to cover my elbow because it was eaten down to the bone and the nerve.
Today, Abby continues to face medical and financial challenges.
It's frustrating and it's devastating, not only to the individual that gets sick, but to their entire family, to the community. It costs a lot of money to take care of us, and I'm one of the luckier survivors.
Today, as a Florida team leader for the national nonprofit group Meningitis Angels, Abby fights to focus attention on the meningococcal bacteria, a bacteria that as much as 15% of the population carries in the nose or throat.
You know, you could be carrying it now and, sneeze on someone. You wouldn't have no idea you're carrying it, and they could die by tomorrow. That's the scary thing about it, and people don't realize that. This is not a vaccine that you think lightly about. I mean, I don't know why everyone in the world wouldn't have this vaccine if it was available to them.
The Centers for Disease Control and Prevention recommends all 11 to 12-year-olds receive the meningococcal conjugate vaccine. Because immunity drops off over time, teens should also receive a booster dose at age 16. Adolescents who receive their first dose of the meningococcal vaccine at or after the age of 16 do not need a booster dose. Following these vaccine guidelines can help prevent the spread of meningitis in places like dorms and summer camps.
Meningitis is a disease that we see higher incidence of meningitis and death from meningitis in teenagers, partly because of their age and partly because they tend to do things like go to camp or go to college where they're living in more crowded living situations and these diseases pass more quickly.
Within the past couple years, I'd say within the past 2 to 3 years, there's been a case at nearly every state university in Florida.
In 2007, the meningitis death of 19-year-old University of South Florida sophomore Rachel Futterman led to a big change in public health policy. In the wake of Futterman's death, the Florida Board of Governors passed a regulation requiring all university students in Florida to be vaccinated with the meningococcal vaccine or sign an opt-out form acknowledging they understand the risk they are taking by not being immunized.
Vaccinations save lives. I mean, I can prove exactly what bacteria and what serotype did this to me, and it could have been stopped by a vaccine.
Low immunization rates among adolescents are putting not just individuals, but entire families and communities at risk, especially when it comes to an often forgotten disease that's been making a comeback.
State health officials say more than 6,400 cases of whooping cough have been reported this year.
Matthew's doctors suspected it could be whooping cough, also known as pertussis.
We have seen outbreaks of pertussis in California and South Carolina, statewide outbreaks. We've also seen regional outbreaks in Michigan, New York, North Carolina, Ohio, and Georgia. So we've seen them in many states in the United States.
Pertussis, or whooping cough as it's commonly known, begins like a bad cold, followed by an uncontrollable cough. It's potentially deadly, particularly for infants. Whooping cough was once thought to be under control, but recently states like California have experienced waves of pertussis cases. That's largely due to low vaccination rates among adolescents. Not enough preteens are getting their Tdap booster, a combination vaccine that protects adolescents and adults from pertussis as well as tetanus and diphtheria.
And what's happened with pertussis is we've found that protection provided by the infant vaccine wanes over time. The antibodies that you develop when you receive a vaccine, you lose those antibodies over time, and so your protection goes away. And so that's why we are now seeing adolescents with the disease pertussis, and we know that those adolescents can spread pertussis to their classmates, to their housemates, to younger children, in fact. So that's another thing that we're seeing with pertussis as well.
All adolescents, preferably at ages 11 through 12, and adults should receive a one-time dose of Tdap to protect themselves against pertussis. Because of the continuing spread of pertussis, the CDC expanded its Tdap recommendations in 2011. The CDC says Tdap can be administered regardless of when the last tetanus or diphtheria-containing vaccine was received. Adults 65 years or older who have close contact with an infant younger than 12 months should receive a single dose of Tdap. Other adults 65 years and older who are not in contact with an infant and who have not previously received a dose of Tdap may receive a single dose of Tdap in place of a dose of their tetanus and diphtheria booster. And children 7 through 10 years of age who are not fully vaccinated against pertussis should receive a single dose of Tdap. All students entering, attending, or transferring to the 7th grade in Florida are required to have 1 dose of the Tdap vaccine.
The stimulus for producing an adolescent pertussis vaccine originated with the high number of cases that we saw in adolescents, but we know that the spread is going to be occurring not just from the adolescent contacts, but also parents and grandparents.
For younger children, pertussis is a deadly disease. They literally cannot breathe. They turn blue, and despite all that we do with medications, with ventilators, etc., we very often lose them. I lost one of those children when I was a resident. The pertussis that baby got was brought home from his father.
The worst possible scenario would be your child getting a vaccine-preventable disease from you.
That scenario became a horrible reality for Rodney Throgmorton and his family in 2003, just after the birth of his daughter Haley.
When Ellie first started coughing, I knew that it wasn't just a normal cough. When she was first confirmed to have pertussis, we were kind of in disbelief. I know that I passed pertussis on to my daughter, and I know I got it from my mom.
When she was just 6 weeks old, Haley lost her brief battle with whooping cough. Haley never had a chance to receive the diphtheria, tetanus, and pertussis combination vaccine that could have saved her life.
Haley passed away when she was right at a month and a half old, and she wouldn't have received her first round of DTaP until she was 2 months old.
There are children that may be too young to receive a dose of vaccine. When vaccines are licensed, they do have a lower age cutoff, and they may still be vulnerable to that disease. Transmission of pertussis from parent to child is a big issue.
The Tdap vaccine was licensed in 2005, too late for Rodney to receive the shot that would have protected both him and his daughter from pertussis.
Less than a year after my daughter contracts pertussis from me, it was a little frustrating when I found out that there was now a vaccine about to be available that would have protected me, and subsequently I would have protected her. If my parents and I had all been vaccinated, then she wouldn't have got that from us.
Adults who are immunized help provide newborns with a cocoon of safety against disease. It's a type of immunity protection known as herd immunity.
Herd immunity, community immunity, is the concept that you don't have to vaccinate 100% of the population to prevent the spread of disease.
So that if you have a herd that's well immunized, even if you bring in someone who is not immunized or who has the disease, the herd is by far more protected. And that includes not just your child, but it includes perhaps your aunt who's on chemotherapy. Other people in the community, not just children who haven't been vaccinated, are at risk. And so herd immunity is a very important concept.
There are hundreds of thousands of people in the United States who cannot be vaccinated. They can't be vaccinated because they're getting chemotherapy for their cancer. They cannot be vaccinated because they're getting immune suppressive therapy for their transplants or their rheumatologic diseases. They depend on those around them to be vaccinated because otherwise they're the ones who are most likely to suffer or be hospitalized and die. They depend on us to protect them. And I think it's our duty to protect them. When we make a choice not to vaccinate ourselves, or we make a choice not to vaccinate our children, it's not just a choice we're making for us. It's a choice we're making for those who are next to us and who come in contact with us. And what's happened to herd immunity is it's breaking down.
And that breakdown in herd immunity is evidenced by the resurgence of whooping cough cases in the United States. The incidence of U.S. pertussis infection reached a high in the 1940s, with around 250,000 cases annually. In 1976, 3 decades after the first whooping cough vaccine was introduced, the number of U.S. cases plunged to just over 1,000. But in 2010, more than 21,000 people got whooping cough. Over the past decade, pertussis cases have also multiplied in Florida. In 2000, there were 48 reported incidences of whooping cough in Florida. In 2009, there were nearly 500 cases reported in Florida.
Some diseases are so highly contagious, measles, mumps, whooping cough, chickenpox, that you need a very high percentage of the population to be vaccinated in order to prevent spread.
In Florida, our rate is in the low 90s in terms of overall vaccination, and that's really good under one lens. On another, we don't have to be perfectionists to realize that we want that higher.
We need to achieve those higher than 90-95% levels of coverage in order to prevent transmission.
But even when we look at overall vaccination rates, which may be quite good, we have to realize that that's an average across a state or across a country. And so there's still going to be pockets where it's much lower. And we've seen this with outbreaks of measles and pertussis and other diseases, Haemophilus influenza.
An outbreak of measles in northeastern Florida in the early 90s illustrates the danger. Close to 200 cases of measles were reported in 1991 and early 1992. 82% involved people who were unvaccinated. Of all the reported cases, 47% occurred among children younger than the routine age of vaccination, a dramatic breakdown in herd immunity.
What you're seeing then is an erosion in vaccine rates in certain communities in this country that has caused an outbreak in vaccine-preventable diseases, that has caused children to suffer and be hospitalized and die. It's unconscionable. It's not okay. And yet we let it happen. How many more children have to die before we say this is enough? Is that the only thing that's going to turn us around? That we just haven't had enough children die from these diseases? Should it be your individual right to catch and transmit a potentially fatal infection? I don't think so. You would like to believe what compels us is that we see it as the wrong thing to do, that we have a responsibility for not only our children, but children who come in contact with our children, and that's what motivates us, so that we see us all as part of something common, that we're in it together.
While disease can spread from within tight-knit communities or within families, it can also come from across the state, sometimes from across the world. It is all part of living in a mobile society.
Almost all the epidemics, the small ones we've seen in the United States in the last couple of decades, have come because of returning visitors, returning tourists, people on a mission trip somewhere else who come back to the U.S. And because there's an incubation period, meaning there's a time when you're infected before you show any symptoms, it's very easy to go back home, be infectious, contaminate other folks, and not know you're sick at all. Then you show the first signs of disease, and it's in some sense too late. You've already spread the condition to everyone else in your community.
Visitors to South Florida and Central Florida can bring with them diseases even when they don't know it. So they might get on a plane feeling perfectly fine, because we know when you get infected with something, there are several days, sometimes several weeks before you feel sick. And so they can come into our state and pass an infection along to the rest of us.
Measles is an example of a vaccine-preventable disease that continues to spread in our mobile society. In 2008, there were more than 130 measles cases reported in 15 states. The CDC says close to 90% were either acquired abroad or linked to imported cases. And more than 90% of those infected had not been vaccinated. In February 2011, the CDC warned that tens of thousands of airline passengers may have been put at risk by a 27-year-old woman who tested positive for measles and traveled through airports in Washington, D.C., Denver, Colorado, and Albuquerque, New Mexico.
These viruses and bacteria do not need passports. They don't need green cards or visas or anything else. They can travel anywhere they can. And we live in a global society where people are constantly moving back and forth.
Sometimes fear and misinformation on one side of the globe can cause a breakdown in herd immunity that affects communities thousands of miles away. In 2009 and 2010, a mumps outbreak in New York and New Jersey sickened more than 1,500 people. Investigators traced the source of the outbreak to an 11-year-old boy who contracted mumps during a summer visit to Great Britain.
We all live in this world, and although we may think of ourselves in the United States as being sort of in an isolated environment, we're not, because international travel is common. And so, for example, when fears of the combination measles, mumps, rubella, or MMR vaccines sort of took off in England, fears that it, ill-founded fears that it caused autism, there was a clear drop in immunization rates in England, causing, massive epidemics of measles and to some extent mumps. Well, the strain of mumps that actually was causing that disease in England was exactly the strain that came over to the United States in 2009, 2010.
The World Health Organization says 95% of toddlers should receive the measles, mumps, rubella, or MMR vaccine to ensure herd immunity. But in England, vaccination levels dropped from 92% in 1995-96 to just 80% in 2003-2004. Outbreaks of mumps and measles across the United Kingdom coincided with this decline in immunization, a drop-off that was largely due to a hypothesis that linked the MMR vaccine to autism.
There was a paper that was published in a British medical journal called The Lancet in 1998 by a British surgeon named Andrew Wakefield, where he proposed that the combination measles, mumps, rubella, or MMR vaccine caused autism. Now, he didn't study that hypothesis. He merely reported a case series of 8 children who had recently received the vaccine. Within a month of getting it, had first been noticed to have signs or symptoms of autism.
The first signs of autism typically show up somewhere between 12 and 18 months. And that's around the time that you get many of your vaccines, particularly the MMR. So if 4 million children in the United States are getting their vaccines around that age, and about 40,000 have autism, some of them are going to overlap. And that's where the fear came from, and it was propagated by some bad research.
Despite the questions surrounding his research methods, Wakefield's article proposing a link between the MMR vaccine and autism set off a global public health scare.
Now, people often refer to that as a study, but nothing was studied. It was simply a case series. It has, however, subsequently been studied the way you would have to study it, which is to look at hundreds of thousands of people, children, who did or didn't get that vaccine to see whether the incidence of autism was greater in the vaccinated group. That study has been done 14 different times on several different continents by many investigators, and the results are very clear and consistent and reproducible. MMR vaccine does not cause autism.
In 2010, the Lancet Medical Journal retracted Wakefield's 1998 autism paper. Great Britain also revoked Wakefield's medical license, but the damage was already done. A shadow of suspicion and doubt had been cast over vaccines and the public and private health officials who advocate for them.
Scientists are people too. Scientists are parents and grandparents, and they very much care deeply. That's why they do what they do, and I think that's often lost. We set up this sort of false dichotomy of the parent versus the doctor, of the parent versus the scientist, or the parent versus the Centers for Disease Control and Prevention public health official. These are all people too who care deeply about what they do. It's always been a false dichotomy to me.
A 2009 national survey of more than 1,500 parents conducted by University of Michigan researchers found that 88% said they followed their pediatrician's recommendations about vaccines, but 54% remained concerned about serious side effects, and 11.5% refused at least one recommended vaccine. Healthcare providers have found that scientific fact often has a tough time competing with personal anecdote.
Anecdotes are a very powerful thing, and an example I'll give is that my wife, who's a general practitioner, a pediatrician, came into the office. She was helping the nurse give vaccines, and she walked into a room. There was a 4-month-old sitting on her mother's lap. While my wife was drawing up the vaccine into the syringe, that 4-month-old had a seizure and went on to have a permanent seizure disorder, epilepsy. Now, if my wife had given that vaccine 5 minutes earlier, I think there was no amount of statistical data in the world that would have convinced that mother of anything other than the vaccine caused it. What else could it have been? The child was fine, got a vaccine, had a seizure, and now isn't fine anymore, even though it wouldn't have been the vaccine that caused it. Children have a variety of disorders that occur in the first couple years of life, and about 90% of children in the United States get vaccines. So it has to happen where children will get vaccines, and then you'll start to first notice these symptoms that have to do with a variety of other diseases, and vaccines are very easily blamed. Vaccines only prevent the diseases that they're designed to prevent. They don't prevent everything else that happens in the first few years of life.
Oftentimes, false rumors and fraudulent information about vaccines go viral on the internet.
There was a huge amount of fear related to a YouTube video of a woman in Seattle who had been a cheerleader and said she couldn't walk forward correctly.
She's the beautiful cheerleader whose heartbreaking story is shocking the nation.
People down here in Florida were refusing vaccination because of this one video. As it turns out, her vaccine that she says she got was given to her in August, and we didn't have swine flu available to us until September, October. So it was impossible that this was caused by swine flu, number one, or swine flu vaccine, number one. But it was also turned out to be entirely a fraud. We cannot look at sources that we don't really know where they're coming from. We can't judge their credibility and hold those up as equal to research that's been going on for years or decades by people who are reputable and well-trained, that is published in peer-reviewed journals, meaning other scientists are looking at this and saying that this is good research that is collaborated by study after study after study.
Vaccines are continually monitored for safety, and like any medication, they can cause side effects. However, those side effects are usually mild and short-lived. Significant adverse reactions rarely occur. Recently, some critics have argued that children are receiving too many vaccines and that it's actually the number of immunizations being given that can cause serious adverse reactions. Medical experts refute those concerns by analyzing how vaccine science has changed over time.
100 years ago, in 1900, children only received one vaccine, the smallpox vaccine. Now, today they receive vaccines to prevent 14 different diseases, and 14 is more than one. But the real important question is, what's in the vial?
When vaccines first started, you would often give a very natural version, right? You'd give something that was very close to that bacteria or that virus in order to stimulate the body's immune response. But of course, that meant that you were getting thousands of antigens. Antigen is the thing that causes your immune system to react. And that meant you had all sorts of side effects. Over the years, we've gotten much better at figuring out what are those 2 or 3 key antigens that our body needs to recognize a particular bacteria or virus. So although there are many more vaccines in today's schedules than there were 30 years ago, the number of antigens, the number of foreign particles, has gone down dramatically.
A single bacteria has between 2,000 and 6,000 immunological components. The total number of immunological components in all vaccines combined is about 160 to 170. So it's the notion that you would be overwhelmed by vaccines is just fanciful. And frankly, our species would never survive if the trivial challenge in vaccines were something that was overwhelming. You have a far greater immunological challenge from a single infection with a common cold than you do with all vaccines combined.
There's risk to anything we do in medicine, but the risk is so minute compared to the benefits, and the risk for the diseases we inoculate against is huge.
Vaccines do have adverse effects. There's no doubt about it. Everything that we do entails some risk. So vaccines can certainly cause you to have a fever, and it can hurt and cause some pain in the area. That's about 5% of kids. 95% of kids don't really experience many side effects from just about any of the vaccines.
Disease prevention by immunization is a public health priority for both healthcare providers and society as a whole. But challenges to fully immunizing children and adolescents remain.
We could be doing a much better job, and the biggest barriers still remain access to healthcare more generally. There are just far too many families in the United States for whom getting to the doctor, getting their child to see a physician is just a hard thing to do.
We often find parents who maybe are struggling, they think they don't have the finances to have their child immunized.
It's an undue, unfair burden on a parent who does not have the money to pay for vaccines. Some of these cost hundreds, more than $100 a piece.
Especially in primary care in this country, I see more uninsured children now, or underinsured children, than when I started.
Although the financial challenges of providing good health care remain daunting, a federally funded program called Vaccines for Children is helping raise childhood immunization levels, especially among high-risk children.
Vaccines for Children has helped poor children because whether they have Medicaid or no insurance, no health coverage, no means of paying for vaccines, they can get their vaccines.
The Vaccines for Children program was created in the aftermath of a major resurgence of measles from 1989 to 1991. The CDC learned that more than half of the 55,000 measles cases reported during that time involved children who had not been vaccinated, many of whom were financially challenged.
Early in the 1990s, Bill and Hillary Clinton decided that everyone should be able to get vaccines because everyone benefits from vaccines.
The Vaccines for Children program was proposed as part of President Clinton's 1993 Childhood Immunization Initiative. It is a federal program that distributes free vaccine to private healthcare providers serving Medicaid-insured children, uninsured children, children with private insurance that does not cover immunizations, and American Indian and Alaskan Native children.
So the Vaccines for Children program basically said private physicians could sign up to be part of this program and say, yes, we will provide vaccines to all the children who come to see us, whether they have insurance or not.
Anybody under 18 can qualify for Vaccines for Children if they have no other source, primarily through private health insurance, to get that. They can get those vaccines for free without any cost to the parent through the Department of Health or through their healthcare provider. Their pediatrician, their family practitioner, their nurse practitioner will have vaccines with the Vaccines for Children program, and they can get that at no cost to them. In fact, if they start before they're 18 but haven't completed a series and they turn over 18, they can complete that series through Vaccines for Children. I worked in an office that didn't have Vaccines for Children, where when we had patients without health insurance, they had to go elsewhere for some of their vaccines. Now we have an office that does have Vaccines for Children, and they get it all in one place. Parents are happier, children are happier. They don't want that anxiety of, I have to go somewhere else to get my vaccine and I'm afraid of it. Get it done, get it over. It is a wonderful public health program.
While the Vaccines for Children program helps overcome financial barriers to immunization, healthcare providers face the challenge of ensuring patients are correctly vaccinated on time and on schedule, and that a record of these shots is securely maintained and accessible across patients' lifespans.
I have to tell you, nowadays it's so complicated, the schedule's so complicated, it's hard for a doctor to know exactly what's been done for a child and what needs to be done. It takes a fair amount of time and energy. And I think the biggest advantage we're going to see in the next 5 to 10 years will be using electronic health information to make sure kids get the vaccines they need.
Electronic health records have enhanced the quality and continuity of care for patients. Many states have organized shot records into centralized computerized databases called immunization registries. In Florida, the Florida Shots Registry helps parents, healthcare providers, and schools deal with what used to be a daunting task by consolidating immunization information into one reliable source.
Frankly, the current immunization schedule is complicated. I mean, we now are up to giving vaccines to prevent 14 different diseases in the first few years of life. There's another couple vaccines that we give in adolescents. There are also different vaccines that we give to adults, including elderly adults. So it's confusing.
Busy parents often don't remember what immunizations their children have received. A common problem in today's world where families may receive treatment from many different pediatricians. The solution? Track vaccination histories through online immunization registries that consolidate all shot records by patient.
And Florida in particular is a very mobile state. People are moving around a fair amount. And having a registry of vaccines, even within our state, is really an essential part of our public health system.
It's also a record for the entire lifespan. What a gift you're giving your child when the vaccines are in there from birth, because then when they're older and they're going off to college, which requires vaccine records to get into college, or going into the military, or making some international trip where infectious disease might be different, they have that into their adulthood.
Immunization registries like Florida Shots go far beyond consolidating and safeguarding individual patient shot records. Organizations like the CDC are also using immunization registries to improve public health planning and policy.
It basically allows public health to track vaccine doses, measure coverage, measure the efficacy of vaccination programs, and allow efficient ordering.
And that efficient ordering can be key to helping keep provider costs and, by extension, patient costs down.
It can save a lot in terms of money, in terms of paying for vaccine doses.
In addition to advancing public health policy and planning, immunization registries have also proved to be effective during public health emergencies.
Immunization information systems are very effective at letting us know who needs a dose of vaccine, and that information is of critical importance in situations where people are moving around and leaving their normal location, disasters.
I really didn't have that much experience with immunization registry. I knew it was a national movement afoot, and it made some sense to me, but Katrina brought it home.
Julia St. Petrie, a pediatrician in Tallahassee, Florida, used Florida Shots to link to other states' immunization registries to locate shot records of children whose families evacuated their Gulf Coast homes because of Hurricane Katrina.
Because the children that came to here in North Florida in particular, from Mississippi and Alabama, the Gulf Coast essentially, some from Louisiana, we found out we could call their states and they were registered, their immunizations were registered. So when that child came over here and was trying to get into school because their house had been devastated and they couldn't go back for at least 6 months and they didn't want to miss school, we could call their state registry and get the immunizations. And that's when it really hit home with me how wonderful it is to have a central registration database, and it saved a lot of grief.
While centralized electronic databases like immunization registries offer healthcare providers new opportunities to increase immunization rates, it still comes down to parents having faith in the medical establishment, faith in their primary care providers, and faith in vaccines that have changed the world we live in.
I'm afraid of the anti-vaccine movement. I understand where parents are coming from. They have not seen these diseases. And all parents, we're all alike. All we want is to take care of our children and protect them from anything and everything imaginable. But as a parent who's been a parent for a while, you know that you can't protect your kids from everything. But you have to make decisions that in the balance have the greatest statistical reliability of actually protecting children.
Illness is a burden that we all have to face. We're always going to need curative medicine. We're always going to need therapeutics to ensure a healthy lifespan. But why not emphasize as much as possible on that which can prevent disease before it occurs? And that's what vaccination is all about.
I think you could argue that since 1900, from 1900 to 2000, our lifespan has increased about 30 years. And almost all of that increase has been due to vaccines that save our lives.